We've been doing a story on the Ridge Hospital, a situation involving Obo brought his father in. There were some concerns about exposing some health workers, and currently about 20 of them, we are told, are in isolation. And then also some disinfection exercises currently ongoing at the emergency unit has been sealed off. You said earlier at the press conference today that there are some investigations underway. What have your preliminary findings revealed?
I don't have a copy of the preliminary findings, but the initial brief that came in was to the effect that this patient had a prior condition and had been tested, but that's, and this is the report. I'm not saying it's true or not. The report was that his earlier test was not disclosed either to the persons who were picking him up in the ambulance or to the persons in the emergency room that had to receive him first. And when respiration was failing, they had to resuscitate, etc., etc. So by the time they were done, about 15 to 20 persons had come into contact with a particular case. And it therefore became important to very quickly activate protocols to ask those persons to go into self-isolation and then to disinfect the place so that you can open it up again for other persons to utilize. They are going through the records to validate if indeed some of these things were actually disclosed or not. But at the same time, it's important also to ensure that the family, some of who are persons of interest in this investigation, also have their own self-isolation, etc. Beyond that, I don't have anything new. It's our expectation that maybe in the next 48 to 72 hours, as they come to some more clarity, get some new staff to reopen the emergency, they'll be able to tell us the next lines of action. But it is critical, and that's why this afternoon we made the point. It is critical that persons make sure they disclose all relevant information to our healthcare professionals. They are our first line of defense. So if we don't make sure they have the information, and if we compromise the health system, we'll be on our way to losing this battle. It's very important, and I hope we all take it seriously.
Okay, but let's talk about these healthcare providers, those in isolation. How are they doing?
My understanding is that they are in isolation. Indeed, I've spoken to some senior doctors who have spoken to some of them.
Okay.
We do not have any information that says that any of them has any symptoms or challenges, but at this stage it's an initial precautionary measure. I'm sure in the next few days they will also, as part of our enhanced testing mechanism, be tested. And by the time they are done with that 14-day period, we're all keeping our fingers crossed that they are fine, and then they can get back to work.